So I have the manual muscle test for hip abduction, ABD. There's actually two different ones. So the first one I'm going to do is hip abduction with flexion. So you're going to put your person in side lying on their contralateral side. So go ahead with their back to you, and then make sure that they're kind of towards the edge of the bed, but that you're right there so they don't fall off. And the bottom leg can be bent to help support themselves, but the top leg, you're actually going to have the leg straight, but you need to have the hip in like slight flexion, so about 45 degrees of flexion. So just keep this straight and then a little forward more. Okay. So then you're going to stabilize over the anterior lateral aspect of the pelvis, and the muscle that you're going to be palpating for is the TFL, so you just kind of need to make sure that you're telling your patient what you're doing since your back is to them. So the motion that I'm going to have you do, Jennifer, is this right here. I'm going to have you lift up and down. And so I'm going to stabilize and then palpate for the TFL, so go ahead and lift your leg up for me. Okay. Then I have you do it one more time, and I'm going to apply resistance to you, so don't let me push you down. And you're going to apply resistance to the distal aspect of the femur, so go ahead and lift up. Okay, so she was able to hold, so that would be a 5 out of 5. If she was unable to, you can put her in gravity eliminated. So I'm going to have you go ahead and lie on your back. But you're kind of going to be, it's not really in supine, it's going to be long sitting, so you're going to prop yourself up with your elbows so that the hips can have flexion. If they're unable to do this, you can use like a wedge or pillows to make sure that they're able to, support themselves. And again, you're going to stabilize over the anterior lateral aspect of the pelvis. And the motion you're going to have them do is the ABD, so actually could you move over just a teeny bit so your leg doesn't fall off. Okay. And then I'm going to palpate for the muscle contractions. Go ahead and do that for me. Okay. Great. So that was hip abduction with flexion. Now the next one is just regular old hip abduction. So you're going to be, again, in side lying. Okay. Back to you? Yep, back to me. And again, kind of close to the edge of the bed. Okay, and with this one, you're actually going to have their leg that you're testing going to be in slight extension. So I'm going to have you make sure their leg stays straight and bring your leg back just a teeny bit. Okay, and this time you're going to be still stabilizing in the same spot, but the muscles that you're going to be palpating for are the glute med and glute min. So I'm going to have you go ahead and do that movement while I palpate. And then just come back up one more time and apply resistance in the same spot as last time, so just the distal aspect of the femur, so don't let me push you down. Okay, so she was able to, and I'm going to have you just scoot a little bit, roll in just a little bit so you don't fall out. And then onto their back for the gravity eliminated one. Scoot over just a bit more, I don't want your leg to come out too far. Okay, I'm still going to be stabilizing in the same spot, only this time you'll be palpating the glute med and glute min. So go ahead and do that for me. Okay. So some common clinical considerations are you just want to make sure that you're telling your patients what you're doing since their back is going to be to you. And then also just because you're going to be, touching their hip area, so you just want to make sure that they're comfortable with it. And then as far as common substitutions, you want to make sure that the patient is not externally or laterally rotating on the way out, because then you're going to be targeting different muscles. And common clinician errors would be not providing proper stabilization so that they don't externally rotate. And then I'll show you guys the going.